Good afternoon, everyone, and welcome to the Assembly Committee on Commerce and Labor. Secretary, will you please take roll?
Assemblywoman Bacchus. Assemblyman Carter. Present. Assemblywoman Duran. Here. Assemblywoman Hardy. Here. Assemblywoman Howdigy.
Here.
Assemblywoman Kasama.
Here.
Assemblywoman Monroe Moreno.
Here.
Assemblyman O'Neill.
Here.
Assemblywoman Torres.
Here.
Assemblyman Yeager. Here. Assemblyman Urick. Chair Marzola.
I am here. Please mark Assemblywoman Bacchus absent excused. Welcome everyone that is here in Carson City with us and anyone tuning in over the phone. Today we will hear two bills, Senate Bill 183 and Senate Bill 283. I will take those out of order. I will be taking Senate Bill 283 first. Before we get started, I'd like to make a few housekeeping announcements. Please turn off or silent all of your electronic devices. If you wish to testify, please sign in at the table by the door. If you have a business card, please provide one. If you have handouts for the committee, please provide 20 copies to the committee secretary prior to your testimony. When testifying, please turn on your microphone and clearly state and spell your name for the record. I expect courtesy and respect in our interactions, even if we may not agree. And with that, we will move to our first bill hearing. I will now open the hearing on Senate Bill 283, which revises certain provisions relating to healthcare records. Senator Pezzina, you may begin when you're ready.
Good afternoon, Chair Marzola, Vice Chair, and members of the Assembly Committee on Commerce and Labor. Thank you so much for having us today. For the record, my name is Julie Pezzina, and I represent Senate District 12 in Clark County, and it's wonderful to see all of you this afternoon. Today, we're here presenting Senate Bill 283. This bill serves to modernize statutes for customers who need their medical records for any reason, including an injury case or for workers' compensation. Currently, written and electronic records cost 60 cents per page, except in cases of workers' compensation where the cost is 30 cents per page. And this cost can really add up to those patients who already have astronomical medical bills. In 2023, we know that most hospitals and doctors' offices have moved from providing written records to electronic records for their patients. This is simply a case of modernization with the times, and this bill seeks to reflect this modernization by reducing the cost per page only for those records that are being sent electronically to the requester. We are still working with stakeholders on amendments to address some of the concerns, and we'll provide those amendments to both the committee manager and to the chair as one document rather than 5 or 6 separate documents once they're ready, which is why the delay, because we wanted to only provide one document. We thank you so much for your consideration, and I'm going to pass it along to my co-presenter, Jamie Cogburn, who will walk through the bill. Thank you all so much.
Thank you. Jamie Cogburn with the Nevada Justice Association. This bill really does modernize. Right now, medical records cost 60 cents per page if you were to request them. So if medical records are kept electronically and you request your medical records for the treatment you provide or that you receive at a hospital, then you will receive those records electronically, but you will just be charged a one-time flat fee, not a per page. Originally, when this law went into effect, the way it used to work is we had paper records. Somebody would go pull a file, they would stand next to a copy machine, copy the records, and move forward. You know, much as we move into the electronic age, this just makes more sense for everybody. You have to remember that these patients have gone to these facilities. They've already paid for the medical treatment. Their insurance has paid for the medical treatment, and all they're asking for is their records. They are able to designate if somebody else wants to get them, whether that's an attorney, whether that's a guardian, whether that's somebody that has a power of attorney. We just believe that charging a simple flat fee really is the Nevada way, and with that, we would open up to any questions.
Thank you for your presentation. Committee members, any questions? Assemblywoman Kasama.
Thank you for the presentation. So my question is the intent that it will still allow paper delivery and or electronic, and have you considered a different cost for either of those? Because obviously the paper does cost more than the electronic. I think most people are going to electronic in all industries, so I certainly understand that, but just wondering, just to clarify that.
Thank you so much for the question. Julie Pizzina for the record. Yes, we have considered that. We know that a lot of smaller offices as well aren't able to offer that electronically, and those can still be offered from a paper standpoint. And of course, patients are welcome to request that on a paper standpoint. It's up to them whether they want it from a paper or electronic method of transmission. And we have had numerous discussions in regards to the cost associated behind both of those methods, and that's why we are still waiting on some outstanding amendments.
As of right now, it would still be for paper 60 cents a page and then $15 for electronic. Is that correct?
Up to 15, because of course, if it was just a 2-page thing sent electronically, we certainly wouldn't want to then have a $15 charge, so we said up to.
May I?
But yes,
Chair. So the only concern I have when we start putting exact numbers in statute is if we're here 20 years from now, and because no matter which way it's delivered, there's still some cost of labor. Somebody, I mean, it's much. I have the same issue in the real estate industry. We have HOA documents. We're spending $300 to $400 for an electronic delivery, and you're talking about $15. And I think the less is probably better because it is pulling the files and doing it, but it still takes somebody to do it. And so have you considered with your base pricing, so to speak, any CPI adjustment or a range? I don't know if there's a big difference between 2 pages electronically or 60 pages electronically. I think it's the file, and but it's just the labor. There is still some labor involved with somebody doing it, and I just didn't know if you thought about how to adjust that without having to come back to the legislature every time there's an adjustment needed.
Thank you so much for the question. Again, Julie Pizzina for the record. And yes, all of those discussions have been happening with the electronic providers, the companies that work with those doctors' offices and with the medical transmission. And because those conversations are ongoing, we weren't ready to provide an amendment today with exact figures because, again, we'd rather provide. We've also been speaking with the Nevada Medical Association as well. And we really just want to provide one amendment. But yes, we've been having those conversations, and that will be remedied when the final amendment hits the chair and committee manager and your group. Thank you. Good question.
Thank you.
And I just want to make Jamie Cogburn for the record make one clarification. If the records are stored in a paper format, it is still 60 cents per page. They don't have to scan them in. It's only if they're stored electronically would you have to deliver them electronically, and it would be a flat fee.
I have a quick question. How did you come up with the figure, the $15 figure?
Jamie Cogburn for the record. Initially, the bill before, the $15 was actually amended. Originally was to be provided for free because you've already paid for the medical services, your insurance has already paid for the medical services. But after discussions with the stakeholders, we amended to 15, and those conversations still continue.
Thank you. Committee members, any questions? Assemblywoman Duran?
Thank you, and thank you for the presentation. So I probably have like 2 questions, but the first one, is this just for copies? Because so when you initially go to the doctor and you want a printout of what happened, do you get that free, or do you have to pay for that as well?
Jamie Cogburn for the record. This is only after the fact. So you went to the doctor, say 6 months ago, and you say, I need a copy of my medical records to provide to another doctor or to someone else, and you're requesting them at that time.
Follow up, Chair? So as well as, I know we had heard another bill that for FMLA to get records that we passed a fee with $10. Why would would you consider being at continuity throughout the state for files for medical records?
Jamie Cogburn for the record. We are open to all kinds of things, and I think ultimately there will be an amendment that'll satisfy everybody and make everybody happy, hopefully.
Committee members, any additional questions? Assemblywoman Kasama?
Thank you, Chair, for the indulgence. I was noticing in Section 1, and again, this might come with the change of the amendment, but it says, Section 1, I think that's line 6 I'm looking at, it says must electronically transmit. So you said they could still do paper copies. I was just wondering how you're going to address that language in there.
Thank you. Jamie Cogburn for the record. If they keep them in electronic format and you request them in electronic format, they must transmit them in electronic format. If you want them printed, even if they're kept in electronic format, and you say, I don't want an email or a portal or some other type of secure method, and you want them printed out, then the charge would be 60 cents per page.
All right, another round. Committee members, any additional questions? I don't believe so. So we will move to testimony in support of Senate Bill 283. Is there anyone here in Carson City wishing to testify in support? I don't see anyone. Broadcast, is there anyone on the line wishing to testify in support to Senate Bill 283?
Thank you, Chair. There are no callers in support at this time.
Thank you. We'll move to testimony in opposition to Senate Bill 283. Is there anyone here in Carson City wishing to testify in opposition? Broadcast, is there anyone on the line?
Chair, there are no callers at this time.
Thank you. We will move to neutral testimony. Is there anyone here in Carson City wishing to testify in neutral? Please state and spell your name for the record. You may begin when you're ready.
Thank you, Madam Chair, and members of the committee. For the record, Chris Ferrari, Ferrari, in the neutral position on behalf of the Association of Health Information Outsourcing Services, as well as SciOx, a medical records providing company, is a vendor to many of our healthcare facilities in state. Here, as I said, in neutral, we've been working with proponents and Senator Pezzina to try to address some of the issues that many of you raised during the question period. I did submit one item just for the committee's reference, and it is the 48 or 45-point record acquisition process that it goes through. So oftentimes it will be said, all you have to do is print, save these things, and ship them over. As all of you know, with different federal regulations, including HIPAA and other, it's difficult to put these records together and costly, and there is human time involved. The proponents and the sponsor have been fantastic to work with and will continue to do so. Thank you for your indulgence.
Jesse Wadhams with the law firm of Black & Wadhams, today representing the Nevada Hospital Association, and I think Mr. Ferrari kind of covered it. The proponents, the NJA and Senator Pezzina have been great to work with. These records do not come without costs, even when they are delivered electronically, and things like authorizations that we have all signed when we go to the doctor's office to release information, those all have to be checked to make sure that that information can be released. And then I learned this, that in behavioral health setting, there's an even different authorization that has to be confirmed and released. So again, we are working very diligently to get to, I think, where we will find a decent compromise, and appreciate all the efforts of the proponents. Thank you.
Good afternoon, Chair Marzola, members of the committee. My name is Sarah Watkins. I represent the Nevada State Medical Association. My association is here in neutral today as well. We've expressed any concerns that we have with Senator Pezzina, and we appreciate the open conversation she's letting us have, specifically to how this might affect small business physicians and their ability to recoup costs if something like this were to move forward. But we are working with her and appreciate the open dialogue. Thank you.
Is there anyone else in Carson City wishing to testify in neutral? Broadcast, is there anyone on the line wishing to testify in neutral to Senate Bill 283?
Chair, the public line is open and working, and there are no callers at this time.
Thank you. Senator, would you like to give any closing remarks? I will now close the hearing on Senate Bill 283. I will now open the hearing on Senate Bill 183, which establishes provisions relating to the collection and destruction of unused drugs. Welcome, Senator Stone. You may begin when you're ready.
Good afternoon, Honorable Chair Marzola, Vice Chair Howdege, and committee members. My name is Senator Jeff Stone, District 20. I'm very honored to be before you, before the Assembly Hardworking Committee on Commerce and Labor. My first presentation before an Assembly Committee here in Nevada. I'm honored to be here today with you. I'm proud to present SB 183, the appropriate and the legal disposal of expired or use prescription drugs is important to prevent drug diversion, protect our landfills, and safeguard our finite water supplies. It will help with diversion. Many citizens often store their unused or expired pharmaceuticals in their medicine cabinets in their bathrooms or in their cupboards. This leaves their drugs vulnerable for children, grandchildren, or even strangers visiting them to take them, ingest them, or if a controlled substance, even sell them on the streets. An example I give is real estate agents that often have open houses. Many of them instruct their owners of the properties to remove all their prescription drugs that are in their homes to prevent them from being stolen by a would-be interested party looking at their home. In our rapidly aging population, which I regret I'm now a member of, there is a higher propensity of being prescribed a controlled substance for pain control, not limited to, but including hydrocodone or Vicodin, as you know, oxycodone or OxyContin, hydromorphone or trade name Dilaudid, or just plain morphine, or a controlled anti-anxiety agent like Xanax, or sedative hypnotics such as Halcyon or Triazolam. These drugs can be potentially sold on the streets for a lot of money. Data from federal law enforcement agencies has shown that OxyContin tablets on the illicit market can sell for between $50 and $80 per tablet. The generic oxycodone's $12 to $40 a tablet, hydrocodone or Vicodin $5 to $20 a tablet, or Xanax or alprazolam, the generic name, as much as $20 a tablet. Because of the inconvenience of finding a drug disposal box nearby, many people just throw their pills in the rubbish, polluting our landfills, or often flush their pharmaceuticals down the toilet, forever tainting our water supplies. You see, these drugs are water-soluble, many of them, that cannot be filtered out by water treatment plants. Hence, these drugs tend to accumulate in our water supplies over time, especially in southern Nevada, where I'm from, where there is a robust toilet-to-tap program that's so essential in confronting our drought and our dangerously low levels of Lake Mead. But we also see an increasing trace drug presence in Lake Mead, which may present health problems in the future. As an example, studies have shown trace drugs that are excreted by the body or those that are improperly disposed of have found their way successfully to Lake Mead, a major source of drinking water in southern Nevada. Some of these drugs that are found in our water supplies have been implicated in potentially causing cancer. So the solution would be to install more drug disposal bins in retail pharmacies throughout Nevada. The DEA has promulgated the Code of Federal Regulations, Title 21, that allows for the installation of drug disposal bins, and through this regulation ensures that bins are placed in a pharmacy where they can be observed while the pharmacy is opened and closed off and locked shut when the pharmacy is closed. This allows for reverse distributors licensed by the DEA to pick up the discarded pharmaceuticals and destroy them, usually by incineration, in accordance with Title 21, which is fully traceable and accountable. We actually have a new company that's investing millions of dollars here in northern Nevada in Story County called Stericycle that is going to be probably a new place for these pharmaceuticals to be destroyed, and I look forward to them coming online here in the state of Nevada. When talking to Stericycle, I found out that they have a presence throughout the United States, and last year alone, over 1 billion pounds of pharmaceuticals was successfully collected and incinerated. So again, there's not enough of these drug disposal bins in Nevada to properly discard these pharmaceuticals. The Nevada State Board of Pharmacy has identified the number of existing drug disposal bins in pharmacies in Nevada and shares that database with the DEA. And what we found was in Elko, there are 3 pharmacy locations where you can appropriately dispose of these pharmaceuticals. In Reno Sparks, 11 pharmacy locations, and in Las Vegas Henderson, 28 locations. That's a total of 42 pharmacies for 3.2 million people, or 1 bin for every 76,000 people. There are also some drug disposal bins at certain police and sheriff departments throughout the state, and they're not counted in those statistics. But for comparison, if you look at Sacramento, California, that has a population of 520,000 within a 20-mile radius, they have 96 pharmacy locations. That's 1 for every 5,426 people. So what will this bill do? This bill will encourage, let me emphasize, not mandate, not a mandate, that pharmacies, especially chain stores within their market share, consider adding more drug disposal bins statewide, making the service better advertised and available, and expand to more locations for patrons to utilize them. And you may ask, well, why would a pharmacy consider placing one of these bins in their pharmacies throughout Nevada? Of course, providing this eco-friendly and public safety service can be advertised as a wonderful community partner, and one could also predict that these bins would increase traffic of people to their stores to buy more pharmaceuticals and sundries as they come in to discard their drugs. And let me add for the record that there's been some discussion about the oversight of these bins in pharmacies. It is as simple as when the pharmacy opens, they just look at the bin to make sure it hasn't been tampered with, and at the end of the day, they look at the bin again and make sure it hasn't been tampered with and just make a notation. That is all that's really expected out of them. Obviously, if somebody comes into the pharmacy with a crowbar, they're going to call 911 and have somebody appropriately apprehended. So pharmacies that install these bins cannot, by this legislation, charge a fee for the patron. So it's a free service for the customers to come in and dispose of their pharmaceuticals. Pharmacies participating need to get regulatory approval from the United States Drug Enforcement Agency. The DEA remains the lead regulatory agency overseeing this program. The Nevada State Board of Pharmacy does not require or mandate or desire to mandate permission via an application for a permit for the same. In some states, such as California, they do, which adds costs for participating pharmacies. There are also no legal requirements for participating pharmacies to notify local law enforcement agencies in the municipality where the bins are located to let law enforcement know that they're there, because the DEA is really the chief law enforcement agency for the program, unless there is an issue of somebody tampering with the bins. So in examining the bill more specifically, if you look at Section 1, Chapter 639 of NRS, it's amended to add a new section. A collector that maintains a secure take-back drug bin for collection and destruction of home-generated pharmaceuticals shall comply with all state and federal laws related to the same, ensure that the take-back bin is placed in a location that is regularly monitored or seen by the collector, namely the employees of the pharmacy, ensure that the conspicuous signage is posted on the take-back bin that is clearly letting customers know that these substances are acceptable except Schedule I drugs, although I don't know how you get somebody from not putting a Schedule I drug, because we're not monitoring what people are putting into those disposal bins. The hours which the deposits can be made into the bin. Ensure public access to the bin is limited to only the hours in which the employees of the collector are present and able to monitor the operations of the bin. Again, we're not asking that the pharmacies hire somebody specifically just to sit there and look at the bin all day. It's right where all the traffic is happening, and they're going to be looking at the bin and looking at customers all day long. It's not meant to be a horrific, onerous policy for pharmacies. It's just going to be there where they can see it. The pharmacists or pharmacy staff, cashiers regularly can inspect the bin and surrounding areas for potential tampering or diversion. That can happen in the morning and the evening when they close up, and maintain such records of a bi-daily, if you will, inspection of these bins. And they obviously are required to notify law enforcement if they are suspecting or if they known of a tampering or theft of significant loss of controlled substances or any other pharmaceuticals no later than 1 business day after the date at which the tampering, theft, or significant loss is discovered. A collector cannot receive compensation from a customer of the collector to maintain the bin. Any collector that maintains a secure drug take-back bin is not subject to any civil or criminal liabilities or disciplinary action by the Professional Licensing Board for injury or harm resulting from the collector maintaining the bin on its premises, unless the injury or harm results from the gross negligence or willful misconduct of the collector. You'll note, Madam Chair, that we had a friendly amendment proposed by Silver State Government Relations that we wanted to really spell that out in the legislation. And you'll see that under Section 3, we are adding language that any collector that maintains a secure drug take-back bin and complies with the provisions of subsections 1 and 2 is not subject to any civil or criminal liability related to maintaining of a drug take-back bin unless injury or harm directly results from the gross neglect or willful misconduct of the collector. Again, there's no mandate for any pharmacy to install or maintain such a bin. It's a completely voluntary program. And the Board of Pharmacy, at their discretion, may adopt regulations for take-back bins if they feel that it's prudent. 6A, Section 1 defines the collector authorized by and registered with the DEA to receive controlled substances for the purposes of destruction. 6A2, in good standing with any licensing authority. 6B defines home-generated waste. 6C defines local law enforcement. 6D defines maintain. 6E defines pharmaceutical. 6F defines secured drug take-back bin. And 6G defines solid waste management. Section 2 becomes effective on the passage of the approval. Section 1 of this Act becomes effective for approval for the purpose of adopting any regulations and performing any preparatory administrative tasks that are necessary to count the provisions of this Act on October 1st, 2023, and for all other purposes. Presenting with me today, and I hope she's here, I think she is Dr. Crystal Riccio, who is an associate professor of pharmacy practice with the College of Pharmacy at the wonderful Roseman University of Health Sciences in Las Vegas, and she is on Zoom today. So welcome, Dr. Crystal Riccio.
Thank you so much, Senator Stone, and thank you to Honorable Chair and the Commerce and Labor Committee members. I appreciate being able to speak with you today regarding SB 183. I am speaking in support of it and just talking about how this may impact my own patient population. For the record, my name is Crystal Riccio, that is Krystal, last name Riccio. I am an associate professor at Roseman University College of Pharmacy. As Senator Stone stated, I am also a collaborative practice pharmacist, and I provide care at Behavioral Health Group here in Las Vegas, Nevada, and we are a comprehensive opioid and substance use disorder treatment center. I have over a decade of experience in primary cares, as well as previous experience in both retail and hospital pharmacy. And as I mentioned, I currently practice within a recovery center. A major common recurring theme as I get questions from patients and colleagues is how do or where do I dispose of any unused medications? This is certainly concerning with our older adult population, as Senator Stone mentioned, who are commonly taking multiple medications, have frequent dosing changes and frequent medication changes, especially when they're trying to save costs and they use mail order, or they end up being a Veterans Affairs patient where they're receiving large quantities of these medications by mail and may not end up using the entire prescription as prescribed. In discontinuing or stopping medications, we have no real way of disposing of these. When there are limited DEA drug take-back days, as was already mentioned, they have accumulated pounds and pounds of these products and bring them back to those disposal locations. The most accessible form of healthcare continues to be our pharmacies, and this is a perfect location for these patients who are already familiar with their local pharmacies and often live within a few miles of these pharmacies to be able to access proper disposal that is not only environmentally safe, but also patient safe. A lot of our older patients, as mentioned, do take multiple medications, and as medications are discontinued and they stay in the home, that does run the risk of duplicate medications being accidentally ingested, as well as the number one source of diversion in our homes being from friends and family from medicine cabinets. So this is certainly concerning for me, the mother of 4 children, when we consider how our youth or our young adults are able to access these medications and take them for sources of diversion. I am passionately involved in educating our community about the dangers of medication misuse, as well as proper disposal. I've been engaged in Nevada with enhancing disposal options since 2009 and have been part of every DEA take-back that we've done twice a year for over a decade now. This is definitely not the best route of disposal. I also dispense and distribute the drug disposal bags, which can safely dispose of the medication to avoid misuse of those medications or getting into the wrong hands. Unfortunately, that's not a very environmentally friendly option to continue. And it certainly does create a barrier, an access barrier for our rural and frontier communities. We know that Nevada is made up of a plethora of different community styles, and pharmacy is something that is available in every one of those locations. Unfortunately, the DEA take-back days, the precincts that have those disposal options, or the pharmacies that have very limited disposal options are not in all of those communities. This bill, SB 183, I believe enforces and improves patient safety. It also helps patients to be able to access safe disposal wherever they live within the state and decrease the patient safety risks of medication duplication or diversion that we know is leading to or contributing to our opioid epidemic that we see today. Thank you for your time, and I look forward to any questions that you may have.
Thank you, Dr. Rocio. Again, Senator Jeff Stone for the record. In summary, honorable committee members, Nevada has a shortage of these drug disposal bins. This is a voluntary program. It is not a mandate. The service is free to any citizen to responsibly discard their pharmaceuticals responsibly and safely with strong concerns for the environment. This will reduce illicit drug diversion, and this will stop depositing these potentially toxic drugs into our landfills and our water supplies. Thank you, Madam Chair, and we would be happy to answer any questions that any of you have.
Thank you, Senator, for your presentation. We do have a couple of questions. Okay. We will start with Mr. Speaker.
Thank you so much, Madam Chair. Senator Stone, good to see you this afternoon.
Thank you, Mr. Speaker.
Congratulations on your first Assembly presentation. Thank you. Hopefully we'll be seeing you very soon over in the Senate when we have our bills.
We look forward to it.
Just a quick question. So in the definition of pharmaceutical, you touched on this a little bit, but it talks about Schedule 2 through 5, but not Schedule 1. Of course, we have cannabis, which is a Schedule 1 federal substance, but no longer scheduled in the state. So do you, in your vision, would someone be able to dispose of cannabis in Nevada in one of these, or would they not be able to, given the sort of gray area between federal and state law on cannabis?
Okay, so certainly I recognize the differences in, marijuana being a Schedule 1. You can have other peyote, you can have other things that are a Schedule 1. There is not a camera, there's nobody watching what is going into these drug disposal bins. So while we can't advocate that people put something that's federally illegal into a legal storage bin here in Nevada, I can assure you that probably people will, and this is an appropriate place for them to go. I mean, let's say somebody comes into contact, their kid gets into something that is on Schedule 1. The last thing they want to do is go to a local police department or a sheriff's department and say, I have this Schedule 1 drug I want to give to you. Now, are they going to be interrogating them? Where did you get it? And this is a very innocent way to just come in, you open the bin up. It's like where you drop your mail in a mail slot, although it's much more protected. You open it up, and you just put the contents in there. You close it, and you walk out. There's nobody interviewing you. There's no cameras on you. And then it is just safely incinerated. They're not going to be inventorying the product at the incineration plant at Stericycle or any other company that's used. They're just going to be weighing it. The people that are coming in will weigh the bag that's in this plastic bag that's in a container. They'll weigh it, they'll take it to the destruction site, making sure that the weight is still what was taken out of the pharmacy, and they will just put it through an incinerator without taking inventory. Other than the poundage, as I reported to you, over 1 billion pounds last year, every year we hope to see that number, of course, go up.
And Chair, could I ask a quick follow-up? Thank you for that answer, Senator. And, I'm trying to remember, I don't know how many years ago it was, 4 or 5 years ago, and you may have seen this too at Harry Reid Airport. Now when you park and you walk across the walkway there, you have the big green bin walking into the airport that I think showed up when cannabis became legal in the state, but obviously not legal once you pass through TSA, and not legal to take interstate, to transport interstate yet. So I just wondered, I don't know if your vision is, if that particular collection site would qualify, because I got the sense maybe it was for more than just cannabis, but I see here that, for instance, I think it had said that, well, let me put it this way. There's some requirements here in the bill that if you're going to do this, you have to do it a certain way. And so I guess I just wanted to ask if we talked about pharmacies, and that makes a lot of sense. But
right.
Would your intent be that it would govern such a thing at the airport that they have already? Because I don't recall. I'm just going to say I don't recall them having a sign up there, for instance, that says what you can collect or what you cannot collect.
Sure.
You might have gotten a phone a friend there. I'm going to talk so long that I bought you a lifeline. Thank you, Chair.
I was prepared, but I want to let my friend have an opportunity to address you. Thank you.
Thank you, Madam Chair. Mr. Speaker, Michael Hillerby on behalf of the Nevada State Board of Pharmacy. There are also a set of DEA rules, and much of what's in Senator Stone's bill on the requirements are in those DEA regulations. The places that are able to have these take-back boxes are drug manufacturers, drug distributors, wholesalers, pharmacies, hospitals that have an in-house pharmacy, and certain long-term care facilities and law enforcement locations. So they couldn't be. You couldn't do one of these in other locations under the DEA rules. You've got to be there. And then much as Senator Stone's already said and included in the bill, needs to be during operating hours, needs to be within line of sight of the pharmacy counter, needs to be where there are staff at the law enforcement facility. So you can't do one of these, even well-meaning people in another place. There are limited locations you can do that because, again, of the kind of drugs they're collecting. And I am aware of you mentioned the drug boxes at McCarran that were set up to collect marijuana. I'm sure you'll be shocked to find that when people leaving Las Vegas, far more ended up in those boxes than marijuana. That was something the Board of Pharmacy has dealt with, along with Metro and the DEA over the last couple of years. It was an astonishing variety of chemicals.
And Senator Stone, just to follow up, I think for those of us that travel from southern Nevada here, when we're leaving in McCarran, now Harry Reid Airport, we have to walk along some drug-sniffing dogs. So they're probably seeing a lot more than just cannabis in those containers.
And Chair, if I could, so I guess my follow-up though is, it sounds like that particular collection site, I mean, it's not authorized under the DEA rules, but would this bill, if we were to enact it, would that make that site go away? Because that is county property, I think, right before you get into the airport. So just trying to, because I think that's a good thing to have that there at the airport, because you'd rather have them put it there than go in the airport and throw it in the garbage can or flush it down the toilet. So just wanted to get your take on whether they would have to get rid of that if we pass this bill.
Thank you. Again, Michael Hillerby. Mr. Speaker, I will get a more definitive answer for you. That was something that the Board of Pharmacy, Metro, and the DEA worked on together. Because it's not advertised as a drug collection box for prescription drugs was how that's being used. I think it would certainly not be the board's intent at all to dissuade the use of that. And I think they've handled that, again, between those two law enforcement agencies and the board. But I'll get a more definitive answer for you and follow up.
Vice Chair Howdigi.
Thank you, Madam Chair. Just a quick question. Mine was regarding, I know you had mentioned in the bill that it was permissive, right? And we currently have one of these for every 76,000 people. You mentioned California has one per every 5,000 people. Is this permissive in California, or how were they able to get to such a, such a smaller number than ours, right? One for every 5,000 as opposed to one for every 76,000.
Right. So it is permissive in California, but what makes it more attractive in California is they have a division of toxic substances. So the division of toxic substances will go to each pharmacy and pick up the contraband, if you will, at no charge to the pharmacy. Right now, under this existing bill, and there are some drug take-back bins in some pharmacies, the pharmacy owner corporation pays for that destruction with the reverse distributor. Now, I'm hoping that maybe in the next session, I know we have a lot of opiate settlement money. This might be a good source to contract with a company to allow for it to be picked up at no charge to the pharmacies, and that way I think more pharmacies will participate.
Thank you. And follow up, just a comment, and I think you're right. I think there has to be some sort of incentive program for businesses to do them, especially if there's going to be a cost for them for the destruction of the material. And so, I mean, I think this is a great idea. It's a great concept. I would love to see more of these boxes. And so my goal is how do we get to that one for every 5,000, just like California? And I think you're right. Maybe this is something we can talk about next session. But thank you.
And just as a follow-up, Senator Stone, again, I think reducing cost and reducing bureaucratic procedures for pharmacies to have these bins. The last thing we want to do is create a bureaucratic blender for them. It's just simply looking at it in the morning, making sure it's not tampered with, making sure it's not tampered with at night. That protects the pharmacy, that nobody's going to come in there quietly and be able to get contraband out of the disposal bins. Reducing the costs and making it easier for them to comply, I think, is going to be essential in getting more pharmacies to participate in the future.
Thank you. Before I go to Assemblywoman Kasama, I have a quick question. Do you know what the cost is for the pharmacy?
Of course, it ranges by the pounds that they're collecting, but what I'm hearing is about $80 to $120 per month.
Thank you. Assemblywoman Kusama.
Thank you, Chair. Thank you, Senator, for the bill. I just wanted to make a comment that I certainly think this is a great bill. I think it's great to encourage. I was part of the rally. I don't know if any of you recall in real estate, we had the rally bags that I gave to all my agents in my real estate office and to give to homeowners when they're moving. So we've certainly been trying to address this issue in our community too, to have a safe disposal for the community members. And I think it's great to work on this bill and to support further encouragement by our pharmacies and that, to have them there. Thank you for bringing the bill.
Committee members, any additional questions? Assemblyman O'Neill.
I think most of my questions were actually asked and answered, but I just want to confirm. So the program's voluntary. The pharmacy has to pay for the box. I was curious how much the box cost itself, if you had an idea.
I've heard, I don't want to state for the record because I don't know exactly, but you're probably looking at between $600 and $800 probably for a box. But I would defer to the chains that have actually put them in, depending on what the manufacturer of the box was and what they charged. That would be solely at the expense of the pharmacy.
And Chair, if I may, and you talked about the opioid money in the future, but currently, are there any grants now available to any of the pharmacies to incentivize them to do this, where they can either have it all done free, including the monthly fees, or at least reduce those fees?
Thank you, Mr. Leader. Jeff Stone for the record. I'm not aware of any grant funds that are out there. The pharmacies that presently have these boxes are actually paying for the destruction of those drugs at their cost.
Thank you, Chair.
Any additional questions? I don't see any, so we will move to testimony in support of Senate Bill 183. Is there anyone here in Carson City wishing to testify in support? Please state and spell your name for the record.
Hello, Will Adler here, representing Silver State Government Relations, representing Stericycle. Stericycle is one of the world's largest disposers of prescription drugs as medical waste disposal goes about, collects and disposes of many different kinds of prescription drugs in many states and takes this topic very seriously. But the proper destruction of prescription drugs is a critical safety issue for Nevada residents and their own selves and Nevada's environment. Stericycle would like to thank Senator Stone for the introduction of Senate Bill 183. Its intent to standardize and promote the prescription drug takebacks that already go on in Nevada is well maintained and well informed, but it is one where you're correct. There isn't current funding today, but I do believe some of the opioid dollars could be assessed at a county level to direct some of the county funds to pay for these if applied for, because we do distribute those funds to counties and they do have the ability to take in and utilize some of those funds as they see fit. But Stericycle would also like to state that they're investing $100 million in their Nevada facility here in Story County because they feel the need to have such a flagship that is capable of taking in these prescription drugs. And as such, they're installing a vault of DEA-specific quantities to make sure they can take in, maintain, and then dispose of these drugs properly. The proper disposal of these drugs would ultimately end the danger that they could hold to Nevadans and the environment around us, because ultimately these maintain their potency until they are disposed of properly, and ultimately that is incineration most of the time. Stericycle did prepare an amendment to SB 183 to correct one of the errors made in the first amending of the bill. The intention is to allow these facilities to house a collection box without any additional liabilities to them for holding them, because they are of public use and for the public to dispose of their drugs properly. Thank you for hearing this bill. And again, we thank Senator Stone for bringing it forward and appreciate your support going forward.
Thank you for your testimony. Is there anyone else here in Carson City wishing to testify in support? Broadcast, is there anyone on the line wishing to testify in support of Senate Bill 183?
Chair, there are no callers in support at this time.
Thank you. We'll move to testimony in opposition to Senate Bill 183. Is there anyone here in Carson City wishing to testify in opposition? You may begin when you're ready.
Thank you, Madam Chair and members of the Committee on Commerce and Labor. I appreciate the opportunity to come forward. I'd hope not to come in opposition. However, there's a few sticking points on the bill. My name is Liz McMiniman with the Retail Association in Nevada. I'm Vice President of Government Affairs, and I represent the chain pharmacies and some independents within the state of Nevada. So I appreciate the opportunity to talk about this. Retail Association in Nevada and myself specifically have been involved with the Take Back program since 2009, like the good doctor from Roseman. As a matter of fact, Reno was the first place to sponsor the first Take Back program, and we had to get special permission from the DEA because the DEA wasn't even doing it at the time. So I just wanted to come to the table to talk about a few things. Senator Stone talked about California doing this, and the monies available for the pharmacies in California was from a fund created by the pharmaceutical manufacturers of America. So Pharma created that fund and paid for these. In Nevada, our members are very good citizens and have come to the table before ever being required. Once the DEA passed their rules and said that we could do this, our members made the decision, looked at logistically what was the best place to put these, the largest traffic, the most prescriptions prescribed, other information provided to them to place these take-back programs within their pharmacies. It's quite expensive. I know that some of them are emptied on a quite regular basis because they're in the high traffic pharmacies in southern Nevada, not necessarily in Elko. You probably don't have to empty it as much in Elko. But we believe in being good citizens, and we also hand out the bags upon request, and there's any number of ways that we've been working at this. So we believe that some of this, we'd like to see Stericycle be able to get into statute if they would like these rules and regulations, and Senator Stone to be able to put this in statute also, but we've reached a sticking point, and that is the record keeping, which we're not required to do by the DEA, and Senator Stone would like for us to do it. Now, while I think record keeping is great in some circumstances, there's no necessary need for this. Federal law doesn't require it, and I don't think the state of Nevada does. So with that, I will close my testimony, and I will continue working with the sponsor on this bill to see if we can get past the sticking points that we've come to today. So thank you very much.
Thank you for your testimony. Is there anyone else here in Carson City wishing to testify in opposition? Broadcast, is there anyone on the line wishing to testify in opposition to Senate Bill 183?
Chair, there are no callers in opposition at this time.
Thank you. We will move to testimony in neutral. Is there anyone here in Carson City wishing to testify in neutral? I don't see anyone walking up. Broadcast, is there anyone on the line?
Chair, there are no callers in neutral at this time.
Thank you. Senator, would you like to give any closing remarks?
Thank you, Madam Chair and Committee. First of all, thank you very much for hearing the bill, and I appreciate Ms. McMiniman's comments. Let me just state for the record that there are hundreds of these bins in California that the chain stores have put in, and they have not found it to be an onerous responsibility to look at the bin in the morning to make sure it hasn't been tampered with, and look at it before they close the pharmacy up to make sure it's been tampered with or not tampered with. I think it's a very minor request that they do that, and frankly, I think they should do it for their own protection, because if there is a bin that has been messed with and there is contraband that's missing, I think the first thing the DEA is going to say, well, did you take a look at your bins that you are supposed to be observing throughout the time that they're in your high traffic area, your pharmacy? And I think a pharmacy would like to say, yes, we did inspect it, and obviously somebody gerrymandered it during the day when, unfortunately, we weren't able to see them doing that. So I think that's really in there for their protection. But I'm still happy to work with the opposition if this moves forward. And in summary, I just think this is going to have an appropriate way for people to dispose of their pharmaceuticals in Nevada and make sure that we protect our landfills and our water supplies. And I hope to gain your support. Thank you very much for the opportunity.
Thank you, Senator, for being here today and for presenting your bill. I will now close the hearing on Senate Bill 183. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Public comment is limited to 2 minutes. Please remember to state and spell your name for the record. Is there anyone here in Carson City wishing to provide public comment? I don't see anyone. Broadcast, is there anyone on the line?
Chair, the public line is open and working, and there are no callers at this time.
Thank you. This concludes our meeting for today. Our next meeting will be Monday, May 1st at 1:30 p.m. This meeting's adjourned.